Welcome to the Global Addiction Therapeutics Innovation Day.
I think one of the ways in which the UN system can assist in this area is developing some guidance for the national governments on how to regulate digital health interventions. Digital health interventions are spreading rapidly, evolving rapidly. The country's capacities to regulate them is not keeping pace, and some kind of normative guidance from UN system from there you have great. That would be very helpful. So Erinn from UK Life Sciences is our next speaker. She's going to tell us about innovations in the addiction healthcare goals in UK. Erinn, the floor is yours.
So hi, it's really great to be here, and yes, it's great to be here, and it's been really interesting to hear about the kind of global picture and what's being done worldwide. So I'm going to sort of hone it in slightly and talk about what we're doing in the UK. So I'm a senior policy advisor working in the Office of Life Sciences on the Addiction Healthcare Goals programme. So just to kind of give a background into what our kind of aims are. So the Addiction Healthcare Goals is aiming to make the UK a place where addiction healthcare innovators across the sector within industry, academia, and then the treatment providers can partner and thrive. So what that looks like is trying to enable the effective design, research, and deployment of innovative technologies and treatments, with the ultimate aim of trying to improve treatment and recovery outcomes through these innovations to save and improve the lives of those affected. So we're broadly doing this across two different strands. So the first of which is catalysing development of innovations. So in particular, funding research projects to improve the treatments available. Then more broadly, looking at trying to create a pioneering drug and alcohol research ecosystem. So building on the existing UK-wide research leadership and capacity, and so growing that to enable a greater number of trials taking place and that kind of sustainability into the future. Then also enhancing the addiction healthcare research data. So the UK does have a sort of long-standing data asset, so making that more simple for researchers to access and utilise and get appropriate findings. And then finally, eliminating and identifying other barriers to research, so in particular, bringing in the attraction for industry to develop more trials and investment in the UK. So in this presentation, I'll sort of go through what we've done so far in the programme, through our kind of horizon scanning and demand signalling work, through to the innovation competitions and projects that we've currently funded, and then a live scheme that's building partnerships between businesses and universities, and then briefly touch on what we plan to do, or sort of hoping to do in the future to build on that progress so far. So just a bit of background into sort of why the Office of Life Sciences is interested in this area. So we're a joint unit shared between the Department of Health and Social Care and the Department for Science, Innovation and Technology. So obviously focusing in the life sciences, but wanting to ensure that we're building on the health and tools that we have available to improve that, but also supporting businesses and industry within the sector to grow within the UK. So the Healthcare Goals programme itself is actually covering a few different areas. So these were set up a couple of years ago, and we're intending to take a vaccine task force type approach, similar to the one that was done within the COVID-19 pandemic. So looking to bring together industry, academia and the third sector and NHS to collaborate in these disease areas and sort of drive forward progress. So we have goals in dementia, cancer, mental health, addiction and obesity. And so obviously these are all quite different issues, so taking slightly different approaches, but all with the underpinning idea of bringing people together to tackle these challenges. So as you may be aware, we had a change of government last year, and when they came in, they brought up their plan for change. So this targeted their approach across 5 different key areas. So firstly, making an NHS that's fit for the future, so prioritising prevention and health sector efficiencies, making Britain a clean energy superpower, which obviously does what it says on the tin, kick-starting economic growth, breaking down barriers to opportunity, so ensuring that everyone has the same opportunities, and then safer streets, which is looking to tackle crime across the board, but in particular areas such as reducing violence against women and girls, knife crime, and then improving the criminal justice system and police presence. So the addiction healthcare goals approach kind of spans quite a few different areas within this, which I think sort of highlights the priority there to work on. So obviously ensuring that we've got better treatments for addiction and preventing future conditions, then also supporting innovative companies within the UK to sort of kickstart that economic growth. So we sort of heard a bit about the global picture of addiction, but sort of within the UK, I think this is a growing issue. So the 2021 UK drug strategy sort of recognised that and committed a lot more funding to this area, recognising the kind of growing harms and costs to society and health. So UK as a whole has quite high deaths compared to the rest of Europe, sort of within the averages, but particular areas really suffering much more. So for example, Scotland and the northeast of England. So a clear kind of priority area to try and support in that. I think a couple of the other points to point out about the UK is the co-occurring mental health treatment need. So a lot of people entering treatment are sort of recognising the need there and that dual diagnosis. So a clear area of opportunity to really target. And then, of course, the co-occurring physical health issues as well, and the sort of ageing population and diverse population that the UK has. Again, another issue that I think is probably cropping up across the world and has sort of been around for a while is the high levels of polysubstance use. So again, another key area within the UK that we need to sort of prioritise innovation in. So starting with our kind of bottom-up approach and the kind of demand signalling, so we conducted a priority setting partnership that brought together members of the community that are primarily affected by problematic drug and alcohol use. So this was people with lived experience of addiction themselves, their family, friends or carers, and also healthcare professionals. So we want to identify what their top 10 unanswered research questions were. So in terms of what we found, I think a lot of these probably won't be super surprising and cover the kind of areas that we know about, but it's been a really interesting process to hear about what the priorities are. So just to call out a couple of these, so particularly obviously reducing drug deaths and best approaches to harm reduction being quite high in the priorities list is definitely an area where we can sort of support and try and build that innovation and target that appropriately where we can, whether that's through innovative tools, detection, response and intervention in overdose events and harm reduction. Also the kind of focus on co-occurring trauma and mental health conditions, so definitely an area where digital therapeutics and other innovative tools like that can provide a kind of holistic approach is really important. And then finally with the best ways to prevent relapse during recovery, so again making sure that we have the treatment options available for people to be supported in the way that they need to be during their treatment or recovery process. So then moving on, so we did a horizon scan of emerging innovations with the NIHR Innovation Observatory. So this was aiming to have a look at what innovations were coming down the pipeline, but also identify any gaps in innovation that we need to sort of target and promote more work in. So just covering a couple of the findings. So obviously with the methods of the scan, and this will publish so you can have a look at what we found, but an interesting downturn in the number of trials I think is probably most likely affected by the COVID-19 pandemic, and the team are doing a sort of updated scan so we can hopefully get some more up-to-date results, but definitely want to make sure we're keeping up that momentum of supporting trials and not kind of losing that progress that we've had over the past few decades. I think, unsurprisingly, obviously most of the trials that were identified by the scan were focused on treating alcohol, opioid or stimulant addictions, but still definitely an area we need to sort of make sure we're not missing any treatment areas of need. I think the sort of most stark issue that kind of relates to the UK situation and possibly more broadly is that less than 5% of trials were looking at treating polysubstance use, which we know is the kind of typical need. So definitely an area there of missed opportunity and unmet need. And then similarly, only 11% of trials looking at co-occurring mental health conditions, which is again a big challenge for the UK. So definitely something we need to try and promote more of. So going into some of the work that's ongoing, so we funded 2 innovation calls. These were targeting trying to accelerate that innovation and get funding out to the sort of innovators that were already in the field, so that we can try and improve outcomes and increase industry involvement. So both these competitions were open to global innovators, as long as they were partnered with a UK-based institution or had a UK-based subsidiary of some kind, so that we could support UK-based research across the kind of broad landscape that we have. So the first of these was looking at reducing drug deaths, which was done in partnership with Scotland, recognising the kind of need that is there. Then we had the Innovation for Treatment and Recovery, which was looking to create or support innovation of tools for the treatment and recovery from opioid and cocaine addictions, but again recognising that polydrug use is the norm, and also co-occurring mental health is a long-standing issue. So I think although I've kind of mentioned a lot of the barriers that the UK has with promoting innovation, I think what these competitions did highlight is the existing strength that's there, particularly across a wide range of institutions and industry partners across the UK, and it kind of just highlights the existing innovators that are there, and also the support that's available in the infrastructure. So particularly within Scotland, they have their innovation test beds, which I think is a really good way to get industry, academia partnered with treatment providers to make sure they're getting that real-world evidence that is required. And again, similar infrastructure exists within England and Wales, Northern Ireland more broadly. So for example, the health innovation networks and partners like that. So it definitely kind of highlights the strength that the UK has, but kind of more that we can do to capitalise on that. So just to call out, I think, the sort of range of innovations that were supported, which were really broad, and I think, again, highlights the strength of the UK. And I know we'll obviously be hearing from a couple of the recipients of funding, but I think this also highlights, although broad, there is definitely more that can be funded, and I'm looking forward to the later presentations to hear more about some new novel ideas. So definitely great progress, but definitely more that can be done. Then also just to call out one of our current schemes that's open to UK-based applications at the moment. So again, trying to build that partnership and collaboration between a knowledge base, so for example, university, with a business partner to sort of stimulate those collaborations in kind of short, intense research projects in innovative ideas. So really trying to build that collaboration and get those networks being sort of strengthened. So in terms of future opportunities that we're sort of exploring, so I've sort of mentioned the progress that we've had so far and the existing strength, but I think given how many novel ideas there are, we want to obviously support a broader range of innovations, and making sure they're kind of targeted in the areas of need, so recognising the findings from our demand signalling work with the priority setting partnership and those kind of top 10 unanswered research questions, and also recognising the findings from the Horizon scan to make sure we're covering all the gaps that we've identified, and then further supporting in the areas of strength that are already there. And then particularly making sure we're enhancing progress towards market entry, so trying to get rid of the barriers that industry is sort of facing when it comes to actually deploying and implementing tools, and similarly for treatment providers. Then again, so enhancing addiction healthcare treatment data, so the data asset that we have in the UK is really long-standing and quite broad. But there are challenges for researchers in accessing this and being able to utilise it to the best of their ability to get good findings. So that's one particular area of focus. And then again, growing the leadership research capacity, so that in the future we can obviously enable more trials and have that kind of sustainability of people entering this field and being interested in the academic side to deliver more trials and studies. So I'll stop there, but we do have a website in case anyone wants to find out any more about some of the projects mentioned, and very happy to, my email's there if anyone wants to reach out and has any thoughts or ideas on some of the challenges and opportunities available. Thank you.
Thank you, Erinn. Again, we have time for just one question. Yes, sir, please.
Thanks for a great talk, Erinn. It was really encouraging that you started off covering wider healthcare goals around prevention, diagnosis and treatment of other conditions and how they interact with the addiction goals. I wondered, as the schemes develop, and with an eye on the current scheme, how much is preventing harms and deaths? How much is the focus specific to drugs and addiction, and how much does it encompass some of those wider comorbidities and drivers, please?
Yes, I think so. There are so within our scheme, obviously, we're focused on developing those innovative tools, but within the kind of broader drug and alcohol treatment policy space, there is more work going on, and the drug strategy that was announced really covered those kind of three key areas. So making sure the treatment and recovery system has the capacity it needs, and the opportunities and options for patients. But then also looking at the kind of broader picture, homelessness and the criminal justice system. So it's taking a very broad look, which I think is really promising, and a cross-government approach as well.
Organized by International Society of Addiction Medicine, sponsors and co-organizers, CNRE, Indivir, Spark Biomedical, Salofa, Ethifarm, University of Minnesota, European Union Drugs Agency, UK Office for Life Sciences,